Desmopressin, or the DAVP, is one of the medications that we can use to help control the frequency. Usually we use desmopressin for patients who have diabetes insipidus, or they have a traumatic brain injury and peeing more than 200 or 300 cc an hour, or at least more than 2000 cc in a day. These patients are high risk for dehydration, and the frequency is way up high. So we use the desmopressin, which help tell the brain that it's an antidiuretic hormone, the antidiuretic medication that helps prevent the patient from being too much. The only thing about desmopressin is that we have to be careful about the patient's sodium level. We have to be careful about the patient's potassium level, because whenever there is water, whenever there is retention of water, then you also invite your electrolytes to be in place. Desmopressin is also used to help manage the symptoms of bleeding, because it is used for controlling the bleeding, especially if you have a cancer patient or a bladder cancer patient that needs coagulation. And so you just have to make sure that we are not excessively coagulating the patient, especially if they have other underlying conditions such as AFib or DVTs. So there are no side effects if you have pyridium. You just have to make sure that you're checking your kidney function, that you are checking your liver function, and that all of it is doing great. But then if you are concentrating for the patient's end-of-life care and you are focusing more on the patient's comfort, then all of these things come secondary, and we always concentrate at the patient's comfort level and if they are able to take oral pills or not. Desmopressin is a form of medication that you can give orally or IV, so keep in mind that if it is through the IV, then patient has to be in the hospital.